The steering committee, with input from 7 working groups, reviewed all of the current assessments and tools to ensure that they are fit for purpose and allow the measurement of a trainee's performance and progression. This led to new work-based assessments which are better aligned with the learning outcomes, are quick and easy to complete on a mobile-friendly platform, better reflect day-to-day practice, enable a timely and constructive feedback between trainees and assessors, and allow tracking of trainee progression using the entrustability scale. The entrustability scale was incorporated into the work-based assessment tools, and it scores trainees from 1, signifying direct input is required to deliver effective treatment, to 4, signifying competent. The entrustability scale reflects how ready the clinical supervisor feels the trainee is for independent clinical practice, and therefore the benchmark is a competent specialist who is safe on their first day as a consultant. The concept of the entrustability scale is at the forefront of modern medical education theory and offers ongoing feedback and tracking of competency milestones, and it's based on real-world assessments. So how does the scale work? The focus is on developing competence over time. It's expected that in the early phase of training, a trainee will require more direction from their clinical supervisor and will be operating at an entrustability level of 1 or 2. However, towards the final years of training, and particularly before their Phase 2 exam, it's expected that trainees would require little to no guidance and will be assessed as meeting entrustability level 3 or 4. Trainees will need to demonstrate progression over time, and they're expected to receive different ratings for different assessments and from different supervisors. A few of the existing assessments have either been replaced or substantially modified. The Mini CX has been replaced with 2 tools, the Patient Encounter Assessment Tool, or PEAT, and the Communication Skills Tool, or CST. The case reports have been substantially reworked and are now called the Case Report Discussion Tool. Since frequent feedback contributes significantly to trainee learning, the assessment tools are designed to be used numerous times throughout the training program to obtain feedback to assist trainees in progressing towards competence. It's expected that trainees will demonstrate improvement as they learn and gain more experience. Trainees hold the responsibility for initiating work-based assessments, although the clinical supervisors may suggest that a trainee observe or discuss a particular case if they feel that the trainee might benefit from it. On the slide, you see the number of work-based assessments that the trainees are expected to submit throughout the whole training program. There are different quotas for Phase 1 and for Phase 2. The trainees are expected to submit 25 contouring and plan evaluation tools, or CPETs, 25 PEATs, the patient encounter assessment tools, 20 case report discussion tools, and 5 communication skills tools. And each one of these is from a specific clinical scenario. The CPET, or the contouring and plan evaluation tool, is one of the new assessments. And this has come off the back of a lot of feedback that we've received over the years that trainees feel that, in particular, contouring and plan evaluation often falls through the cracks. And this tool aims to remedy that. The tool aims to aid trainee learning in all aspects of treatment planning, from simulation all the way to plan appraisal. And the aim is to do this throughout their training program, really from day 1. The tool also aims to facilitate interactions between the trainee and the supervisor and to capture feedback on the trainee's performance. By doing this, it allows tracking of trainee progression over time in competencies in all aspects of treatment planning. And where trainees are not progressing, it allows us to offer appropriate support and remediation. So this is what the tool looks like. Now I'm going to show you examples of all of these work-based assessments, bearing in mind that the final product will be a electronic form, so it may look a bit different, but the questions will be the same. So the CPET, as I've already mentioned, assesses all aspects of planning, from simulation, target delineation, organs of risk, and plan evaluation. And it's basically a tick box in each of those, grading the trainee on the entrustability scale from level 1, a direct input required, all the way through to competent. And so you'd expect that a trainee towards their end of their training could attend simulation, um, discuss image fusion with ERTs, do their target volume and OAR delineation, and appraise a plan appropriately, all without significant guidance. The PEAT, or the Patient Encounter Assessment Tool, is a tool that aims to aid trainee learning in aspects of care for the oncology patient. Specifically, the trainee's ability to obtain a history, conduct a physical examination, interpret patient investigations, or order additional investigations as required, and then to synthesize all of this information into a coherent management plan. It also assesses the trainee's ability to interact with patients and carers through an assessment of the use of patient-centered interviewing skills, explanation of management plans in a language that is understandable, and also their overall professionalism. This second point is optional. The PEAT can be either observed or completed away from the bedside, but trainees will be required to complete a minimum number of observed assessments. Lastly, again, like with all the tools, the aim of the PEAT is to track progress and to develop competencies over time. This is what the PEAT looks like. And again, as you can see, the allows for you to assess the trainee on their history, investigations, tumor specific pathology, and management plan, and a discussion of side effects and outcomes. The second optional section is if the PEAT is observed, then it allows the supervisor to assess the trainee on how well they collected information, how well they explained relevant details to the patient about the management plan, and generally a global score on their professional conduct. And finally, there's an overall level of entrustment at the bottom. Whereas the PEAT is a relatively short assessment, the case report and discussion tool is designed to be a more in-depth case-based discussion than the PEAT, and it's basically an evolution of the existing case reports. The tool aims to aid trainee learning in aspects of care for the oncology patient by building their knowledge around care of patients with specific tumours, developing management plans based on evidence, including a detailed knowledge of radiotherapy and other treatment modalities, and it's also a way for trainees to demonstrate competencies from the intrinsic roles. And again, it allows us to track trainee progression. So this is what the case report discussion tool looks like. And again, it allows for assessment of identification of the problem, developing the management plan tailored to this particular patient, as well as sections to assess trainees on how well they collaborated with colleagues. So this is, for example, if the case was discussed within an MDT, and whether the trainee discussed it with the MDT or communicated with the members of the MDT. Justification for treatment is similar to the existing case reports and will include a short literature review of the pertinent data supporting the proposed management plan, and then a detailed discussion of the radiotherapy treatment and technique, as well as a discussion about the expected outcome and follow-up. And lastly, there's a section to assess for the quality of the written communication. So basically, this, how well written is the case report. The communication skills tool uh, is focused on providing feedback to trainees primarily on their communication skills. And this is done over a number of scenarios. There are 5 scenarios in total, and trainees will be required to complete at least one from each of these. And those scenarios are an initial consultation, a follow-up consultation, discussion of treatment options and recommendations, and obtaining informed consent, recruiting patients to a clinical trial, and breaking bad news. The CST allows assessment of the ability of the trainee to establish rapport, open discussion, gather information, understand the patient's perspective, share information, and reach agreement. Uh, and also their ability to demonstrate empathy and provide closure. Now, not all items here will be applicable to every scenario. And so if they're not applicable, you can mark not applicable. The final assessment, however, is simply a single global score on the entrustability scale. So it's the supervisor's overall judgment: is this trainee competent at the level of a first day consultant? So there are some suggestions around the work-based assessments. The Ideally, they should cover a broad range of topics and tumor sites and a range of treatment complexities from simple uh, routine scenarios to also include some more complex and challenging scenarios. They should be completed by multiple clinical supervisors. They're designed to be performed frequently. Trainees need to take responsibility and initiate the assessments. And trainees also must complete a minimum number of work-based assessments, but they're encouraged to complete as many as they feel would be helpful. Particularly some of the assessments, like the case reports, um, may form the basis of the trainee's study notes, and contouring and plan evaluation tools, for example, um, trainees are really encouraged to do as many of these as possible because that will aid in their learning. The assessments, whilst on the surface may seem daunting, certainly the number of assessments may seem daunting, most of these tools are designed to be not overly onerous on the supervisors or the trainees, and with the electronic platform should be completed in a short space of time. For more information, please visit the TAR website at ranscar.com/TAR or email the RO training team at the college.